Hey, Nate, right? Yes, this is my son. Oh, hi. Hi. Oh my gosh, you are so big. Last time I saw you, you were so small. This is Summer. She works at the hospital right by our house. Okay, I've seen you before. I can't believe how big you are now. Oh my gosh, hi. I haven't seen you for so long. How's it going? Is your boyfriend coming? No, he couldn't come. He has to work. Oh, that's too bad. I'm glad you could come, though. Hello. Hello. This is my good friend. Her name is Melanie. Hello, nice to meet you. This is Nate, and this is Aaron, their father and son. And I don't know who this is. This is Brian. He's my old roommate from Gallaudet. Hi, nice to meet both of you. This is Summer. This is Nate's first time going to Gallaudet. Yes, I'm excited to go to homecoming and meet all sorts of new people. That's very exciting for you. Maybe we should get going? Yes, let's go. Oh no, it looks like our flight's been delayed. Well, what are we gonna do? We could go check at the gate. That's a great idea. Let's go. I can't believe we're delayed. And now they won't even let us leave the gate to find a place to go smoke. They need to have more rooms for smokers in the airports. Yeah, it's hard enough sitting through a 5-hour flight without smoking. And now it'll be even longer till my next cigarette thanks to this delay. Come on, Dad, it can't be that bad. Besides, you've been talking about trying to quit smoking. Here's your chance to stop and do it. Mark Twain once said, quitting smoking is easy. I've done it 1,000 times. I know, I've smoked for 30 years now, and it just seems impossible now. But Dad, the smoke is making my asthma worse, and it's affecting my running. Fine, I'll smoke outside from now on. Well, that's fine for me, but think about the bad effect it has on your health. Nate's right, smoking is not good for your health. That's right, 6 months ago I found out my dad has lung cancer, so I had to quit. I feel better now. When I exercise and go up the stairs, I'm not out of breath. I see a big improvement, and I can even walk with my kids. I've been trying to quit, but it's so hard. My boyfriend's a non-smoker and really hates that I quit. I mean, smoke. He says kissing me would be a lot nicer if I didn't smoke. Seriously, though, he says my clothes stink, and my whole apartment smells of stale smoke, and my teeth are yellow. And he says he won't marry me if I don't quit, because he doesn't want to have to see me die early and leave him alone. Or worse yet, with a bunch of kids to raise by himself. He doesn't want that. I'm not really motivated to quit. It's sad to think I might end up an old maid, but fortunately he's very patient. Well, wanting to quit is an important first step. The most important part of quitting is a commitment and sticking to it. So you're on the right track. See that, Dad? You've got to want to quit first. If you really love me, you will quit. Brian, I'm sorry to hear about your father. Maybe you can tell us how you quit and give us some pointers. Yeah, I've never met anyone who's actually successfully quit. My boyfriend has never smoked, and he doesn't realize how hard it is to quit. Sure, having motivation is the most important part for me. Finding your own reason to quit is a big first step. I had to do that. I didn't think about quitting until I saw my dad in the hospital, and then I realized how serious it was. The doctor said that every major organ in his body is affected and failing from all his smoking. His lungs are in terrible shape, they're filled with black gunk, and that grosses me out. He also has a bad heart. Not to mention he has really bad circulation and can't walk without suffering terrible pain in his legs. My dad knew that smoking was bad for his health, but had no idea how many problems it would cause. And of course, I think that my mother is suffering even more. He's been sick for many years, and now she's likely to be a widow much sooner in her life. So they should take advantage of the time now and really relax and enjoy life. Yeah, as a nurse, I can tell you about the health consequences of smoking. Just about everyone knows that smoking is linked with increased risk of getting cancer. I think it's also important to mention when I took health education class, I learned that lung cancer is also the leading cause of cancer in the U.S. In fact, smoking causes about 90% of lung cancer deaths in men and about 80% in women. Also, statistics show in 2003 about 157,000 people died from lung cancer and there were about 172,000 new cases. These were all preventable deaths. Even worse, there are other cancers linked to smoking and other tobacco products. It can cause cancer in the vital organs. Many other health problems are linked to smoking. Smoking is a major cause of heart disease, stroke, and circulatory disease, some of the leading causes of death in this country. I've also seen so many other lung diseases associated with smoking while working in the hospital. Smoking causes injury to the airways and air sacs of your lungs, which can lead to chronic obstructive pulmonary disease, COPD. Which means frequent respiratory problems that include emphysema. COPD is the fourth leading cause of death in the U.S. That means that more than 100,000 people die from COPD every single year. Smoking causes more than 90% of those deaths. Wow. Smokers tend to get sick more often and also have more acute lower respiratory illnesses, such as acute bronchitis or pneumonia, than non-smokers. Smoking is related to asthma among children and teenagers. Asthma is a disease that causes inflammation of the airways, causing them to become constricted and obstruct airflow in and out of the lungs. See, Dad, smoking is bad for my asthma. That's why when I run now for the track team, I'm wheezing more and haven't been able to get the best times. It's no wonder, because cigarettes are full of toxins and poisons. No, it's different. I'm the one smoking, not you, and you've always had asthma. Yes, that's secondhand smoke. When a non-smoker breathes in the smoke next to a smoker, that is secondhand smoke. Smoke can definitely make his asthma worse. That's what I've been telling you. Secondhand smoke is bad for you, and that's why all these public places have banned smoking. True, I know. I really need to think about quitting soon. I've heard all the health risks and stuff, but I still can't get motivated to quit smoking now. I wouldn't really care if I get sick when I'm in my 70s. Actually, quitting smoking is even more important for a young woman. Smoking can make it difficult for a woman to get pregnant. Smoking is also harmful during every part of the development of the baby and often causes the baby to be born before the normal 9 months. That increases the chances that the baby will be born with health problems. And sometimes the baby can die. This risk continues to be harmful after the baby is born, just like Nate is experiencing the results of secondhand smoke from his father's cigarettes. But I don't want to scare you into quitting smoking. There are also lots of other reasons to quit besides the effect on your health. Yeah, think about it. You'll smell better, and you'll have whiter teeth, fresher breath. My friends actually said I've looked better since I quit because the wrinkles on my face are less prominent and my skin isn't as discolored. Now I realize that my smoking affects my sense of taste, which is awful. I guess I've noticed that my skin looks more leathery compared to my friends who don't smoke. I guess I could use the money that I would save from smoking in better ways. Yeah, Dad, we could use the money to go to ball games together more often. Or save for your college fund. I guess I could. Seriously, I've already smoked for 20 to 30 years. Isn't it too late for me to quit now? Probably damaged everything already, right? Actually, it's never too late to quit. You will derive the health benefits from quitting smoking right away, and the benefits just keep growing. You can still prevent the terrible diseases associated with smoking. I want to add something too. I remember reading an article that said after you quit smoking, there's a list on how to improve health. It said within 20 minutes after quitting, your heart rate slows down. 12 hours after quitting, the levels of poison gas in your blood drops to normal. 5 years after quitting, your risk of stroke is reduced to that of a non-smoker's. And 15 years later, your risk of heart disease and other related illnesses are back to that of a non-smoker's. So I've been trying to quit for the last couple of months, and I would last maybe a week before I just had to have a cigarette. I've tried the gum, but I just couldn't stick to it. I'm just so easily tempted. I'm just not strong enough to quit. What can I do? You have to keep in mind that many people try several times before they're finally able to quit permanently, so don't get discouraged. The more times you try to quit, the better chance you have of succeeding the next time. Remember, you're not the only one who's tried to quit but couldn't. But if you are tempted and give in and have won, don't just give up. Stop and ask yourself why you are tempted, and make a plan for next time and try again. If you have a relapse, you can still always try again and again until you succeed. Did you know scientists found that there's no one way to quit? But the most effective way is to combine different methods of smoking cessation together. It's interesting, for instance, you tried using the gum, but maybe you need to add one or two other methods together to help you quit. For example, you can use the patch along with a medication and go to a support group. Oh, I should tell you the support groups are really important to successfully quitting. Brian, how did you quit? Like Summer said, I looked for different ways and found it helpful to use several methods together. First, I went to my doctor and we discussed how I should go about quitting. We decided I should go to counseling and combine that with a nicotine replacement therapy, NRT. So I agreed and combined two things, the patch and called the smoking cessation helpline and talked with counselors. So how do the gum and the patch work in trying to quit? Yes, we should talk about some of the different ways to quit. Some people choose to stop cold turkey without the patch. They just stop smoking. While others find it helpful to use the nicotine patch or the gum, whatever works for them. As Brian said, you should discuss with your doctor the different ways to quit and find the best method for you. Most people have difficulty with quitting smoking because cigarettes contain nicotine. That's an addictive drug, so your body will crave the cigarette because of the drug. That's why the NRT nicotine replacement therapies are helpful in reducing the craving till you quit. Whether you use the patch or the gum, it will significantly decrease the body's craving for a cigarette. I tried the patch before. It's a small patch with cotton that has nicotine in it. When you wear it, the nicotine passes through the skin and into the bloodstream. I felt the nicotine go through the body. I wore it a few times for a short time, but I didn't follow the instructions the way I should have. I think if you follow the directions, it should work well. I got a prescription from my doctor to use it, but you can also buy them over the counter at the drugstore, and they have pretty highest strength and tapered down because I was such a heavy smoker and used it for about 12 weeks. But the most important thing to remember is you can't use the patch and smoke at the same time. That can cause very serious, sometimes life-threatening health problems, so I didn't risk it. How do you think the patch compares to chewing gum? Well, I never tried the gum, but that's your personal choice. I was told the gum is as effective in delivering nicotine to your system. I was hesitant with the gum because of possible problems with my teeth, and I can't really chew gum at work. I have to say that the patch was definitely helpful with my withdrawal symptoms, so I would think the gum would work equally well. If you can't chew the gum, another option is nicotine lozenges that you can roll around in your mouth till they dissolve, but you can't chew them. And that releases the nicotine through the body. They seem to be just as good as the gum. Dad, didn't I buy you some of the nicotine gum before? You were supposed to start chewing it the day you decided to quit smoking and chew it regularly, not just when you had the cravings. Yeah, I remember, but I just didn't like the taste. It was kind of peppery. I actually liked the taste, and it was good to have something to do with my mouth while I couldn't smoke. There's also a nicotine nasal spray that I tried. It worked pretty well, but I was working outdoors a lot, and it was winter, and the spray didn't work in that situation. So there are lots of other options. Summer, you also mentioned a medication to help stop cravings. What's that? The medication is called bupropion, or Zyban. It's a prescription drug that can reduce withdrawal symptoms and doesn't contain any nicotine. You would need to get it from a doctor and start using it about 1 to 2 weeks before your quit date. You can use it in conjunction with the patch or the gum and with counseling, and keep taking it for about 7 to 12 weeks. So what you're saying is that I can use the gum to help with the nicotine cravings and the medication plus counseling to help me deal with all the psychological factors like stress in my life. Exactly. You could be successful when you combine all these different quitting smoking aids. You want to use all the tools available to you, right? But remember, you can only use one NRT, meaning you need to choose either the gum or the patch, not the two together. And when you're using the patch or the gum, you cannot smoke. I will definitely remember that. I needed something to replace the activity of smoking. The cigarettes are great to help me deal with the stress in my life. Like, it's therapeutic, and I just can't imagine how to cope without them. Actually, you're right. Quitting smoking is a lot more than getting through the addiction habit. The physical addiction itself is the worst during the first 24 hours. It's the habit of smoking that is really difficult to break. It's a ritual that is part of our life. We have coffee and a cigarette. Friends go out for a talk and a smoke outside. So it's more difficult to quit smoking because cigarettes are so much part of a smoker's life. That's where I thought the counselors at the Smokers Helpline were really helpful. A telephone helpline? Do they have TTY? Yeah, I went through a whole program. They sent me pamphlets, guided me step by step on quitting, and if I was tempted, I would call, and they were there for me quickly. What did you do, and how did that work? Brian, tell us a little more about how you quit. That might be useful information for me to have to give to our patients. Sure, the line I called is a hotline called the California Smokers Helpline. I told the doctor that I planned to quit, and he told me how, as part of my plan, to quit. I knew I wanted some counseling in addition to using the patch. Right away, they helped me think about my motivation to quit and told me what steps to take. I then signed up for the hotline counseling program. How long is the process? The first call was about 45 minutes. They mostly asked me a lot of questions about my motivation to quit smoking, what previous attempts I made to quit, and what things triggered me. They also wanted to know if I lived with friends who smoked and if they were willing to quit. They mailed me some brochures to reinforce how I would proceed in the quitting process. I was ready to set my quit date. Also, the great thing about the helpline is they called me to keep me motivated, and they seemed to know exactly the right times to call. How do they do it? They called me on my quit date, then later on that night to help me with the withdrawal symptoms and really help me start a mindset that I didn't want to smoke anymore. They taught me skills in how to mentally resist temptation for the rest of my life. I know what to do if I get stressed and am tempted. I'm done smoking for good. I was able to deal with stressors and triggers without relapsing. Wow, that sounds like a lot of time. Every time I called, it was about 15 minutes each, and they were very flexible, encouraging, and supportive. It was really good to have someone to talk to when I was afraid of slipping. They kept me on track and actually taught me skills about managing stress that will help in other areas of everyday life. So how did you feel when you first quit? Even though the patch helped me with withdrawal symptoms, I still struggled a lot because I missed the habit of smoking. Although it didn't seem like it at the time, I started to realize that the withdrawal was really worth it. It was a sign that my body was getting rid of the cigarette's toxic substances. That's good news. Patients say that symptoms can last 2 to 4 weeks, but are the worst during the first 24 hours. I think I had all the withdrawal symptoms. I was nervous, had headaches, and my boyfriend said I went through major mood swings. He said I ate all the time and was too restless to sleep. I had the same problems. Headaches, can't sleep. The problems with thinking clearly and the coughing all went away. It was scary and a little annoying to feel that way, but remember, it's very brief and you're getting rid of some bad toxins from your body. Yes, some people do gain weight once they quit smoking, but remember, quitting is still better for your health and your appearance. Plus, you can prevent weight gain by being disciplined in exercise and other ways too. I drink lots of water, and since I stopped smoking, I ate a lot of healthy snacks to keep my hands and mouth busy. After a year of being smoke-free, I heard most people only gain an average of 5 pounds. I definitely feel a lot healthier and look a lot better now than when I was smoking. I'm also losing the 5 pounds of weight that I gained while I was quitting smoking. Another 2 more pounds and I'll be back to normal and smoke-free. I'm afraid to admit that my friends are probably a bad influence on me because all of them smoke and I'd light up too. I'd feel strange whenever we go to watch a game at a friend's house or something and they all light up. It would be really weird. I can't imagine hanging out with them and not smoking. Maybe I should switch to cigars or chewing tobacco. I really don't know. No, chewing tobacco is worse than cigarettes. Nate's right. Smart boy. Cigars and other tobacco products are just as carcinogenic, meaning they can still cause all those cancers. They're all bad. Chewing tobacco is no better. People who chew tobacco are at much greater risk of getting cancer of the mouth. There's got to be other things you can do with your friends. I'm having the same problem. I seem to associate smoking with going out. How do I stop thinking that way? Those are common triggers for people. Being around other smokers, drinking alcohol, and highly stressful situations. But if you're aware of these triggers before you quit and have a plan on how to deal with them, then you will be more successful in quitting. That's where I found the counselors helpful. They kept me motivated when I had to deal with all those triggers, and their pamphlets gave me great tips on how to resist all those urges. You can't even smoke in most public places in California anymore and a lot of other states and countries. And just think, with all the money you'll save by quitting, we can go to baseball games where there are no smokers. And you would be surprised how encouraging your friends can be, even those who smoke. I asked my smoking friends not to smoke around me the first few weeks, and especially not to offer me any cigarettes, and they were respectful. They even asked me to help them to try to quit. I guess I could look at those brochures to see what different strategies I could use, and if it would work for me. I always try to tell people that you were born a non-smoker, and you can be a non-smoker again. I know that it's incredibly difficult to quit. When my dad was first diagnosed with cancer, he still continued smoking, even though it was going to make his lungs function worse and worse. It was sad for my family, and really motivated me to quit as soon as possible. It's been a tough 6 months without cigarettes, and with my father dying, but quitting smoking has been the best thing I've done for my family and me. Thanks for sharing your story with us. It's definitely more compelling when you hear a real-life story of someone affected by a smoking-related illness to help me realize how important it is to quit smoking. I'm glad my dad's story helped you guys. There are lots of resources to help you quit. Not just telephone counseling, but also face-to-face counseling. Like we talked about the patch, the gum, and the medication, there's also lots of organizations with good information to help you quit. And you know, you succeeded, which means if you can do it, I feel like I can do it too. I'll always remember your dad's story and the importance of quitting smoking. I'm grateful. I can give you a list of resources available if you guys are interested. Dad, I hope you know that I'll do whatever I can to help you quit. I appreciate that. Thanks. Let's set up a quit plan for me and I'll stick to it this time. Let's do it together. I'm ready to set a date in stone. And a wedding date. Hey, I think we better stop. Plane should leave soon, so let's go.